So, sitting in whatever position is comfortable for you. So, if you're more than 34 weeks, it's not particularly useful to sit cross-legged anymore because it slows down the circulatory system. So, you might want to come into a more open-legged position, like butterfly pose, where the soles of the feet come together, or even just extending the legs out either straight or even out wide, so whatever feels comfortable, or kneeling, but not after 34 weeks. Likewise, if you've got any niggles with your hips or your pelvis, or particularly your symphysis pubis, you might want to sit in one of those symmetrical positions instead. Okay, so just coming into your comfortable position and taking a moment to see how you feel. You're just checking in with your body, noticing how your body feels. Noticing particularly any changes. So the pregnant body changes quite significantly, but sometimes not rapidly. So you might have a month of feeling exactly the same, and then suddenly you'll maybe have a growth spurt or a big hormonal dump, where lots more hormones start to arrive, and then everything changes. The whole landscape of your body might change. You might start to get heartburn, you might start to get hip pain, so you might find you're a little bit more breathless. So these things can happen quite regularly throughout your pregnancy. So once you've made this connection with your own body, just make a connection down with your baby. And just become aware of the feeling, first of all, of your baby in your belly. And that feeling will be very different depending on what stage of your pregnancy you're at. So if you're in the very early stages, just coming towards the end of your first 20 weeks, or if you're still in your teens, regarding the weeks, then you may not be having any movements at all. So for you, it's just a case of knowing that your baby is there and just feeling their presence. And then turn your awareness to your breath. And just noticing how your breath is at the moment. So noticing, does it flow smoothly? Or does it feel difficult? Sam, do you want to get your back? Because if you see that, see what you want to do is get your back of your pelvis against the, so you want to come right back. Yeah, that's better. And then you can even move, that feel okay? Again, heartburn. So yeah, I think it's because you were slumping forward, so you're compressing it. So what you need to do is get your pelvis to turn it away. So you kind of want it almost to tilt your sitting bones backwards like that, rather than tucking under. You want it back. And that just gives everything a bit more space. And then thinking about breathing into the sides of your body. So as you breathe in and you inflate your lungs, see if you can breathe outwards to the sides of your ribs. And this is particularly good when you get to that point in your pregnancy where your baby now takes up your diaphragm space. So you can't really breathe down anymore, you can't breathe vertically, so you have to work at breathing horizontally. So just finding that width in the body. And then also maybe breathing into the back of your body as well. So finding a little bit more space. And as you continue to focus on your breath, breathing slowly, breathing deeply, and just retracting the muscles around your throat a little bit so that you can find a soft snoring sound, ocean breath. It's a little bit as if you were sighing under the breath. It's the same sensation we make when we are sighing, but with the mouth closed, so the breath is coming in and out of the nose, but it slows our breathing down. And then we're going to start to make a little bit of movement. So you might want to come slightly forwards from the wall because we're going to start to move our spine. So we're going to do some circular movements, and I want you to think about the belly as if you're moving from your abdomen. And what you're going to do is roll your belly forwards and around to the left, and then draw your belly backwards as you move around towards the right. And just continue in this same way. So just rolling your belly around in a circle. This can get rid of the tightness that you might have in those muscles around the waist and around the lower back. And then the next time you get to the front, you're going to change direction. So now you're going to roll the belly around the other way. And the next time your belly comes to the center, it's coming into stillness. So then from here, if you can just come up and over onto your hands and onto your knees. If anybody isn't comfortable, are you all okay with the wrists? Okay. So if you're not, you can come down onto your elbows. If you've got carpet tunnel. And then we're going to move the pelvis. So when we were sitting, we were moving the belly. Now we're going to move the pelvis. So you're going to circle the hips as if you were drawing a circle that was parallel to the floor, so horizontal. And you're still using that slow ocean breath, the Ujjayi breath that comes from contracting the muscles around your throat. And this is one of our labour moves. So really useful for stage 1 of labour when you are dilating your cervix. And then change direction, go the other way. And then coming back to neutral, making a space between your knees that is big enough for your baby and your belly. And then roll your spine to the ceiling, tuck your tailbone under and gently ease your hips all the way back onto your heels. And as you get there, you might find that you may need to widen the knees a little bit more. You might have underestimated or overestimated the space that you needed. And then from here, just a gentle shift of your weight from side to side. And this is a really nice stretch that can get into your lower back, which is often compressed during pregnancy. So this is a really good move to do regularly when you are pregnant. So these dropping the rounded back onto the heels. So you don't want to flatten the back out, you want to keep it back. And then to come up, push your shins into the ground. And you should effortlessly rise up. And then we're going to do the same again. Round back, tuck the tailbone under, and then take the hips all the way back onto the heels. Again, you might just feel the need for a little bit of a sway from side to side. And then push into the shins to come all the way up. And then you're going to take your left hand and place it to the outside of your right hand. And we're going to do the same thing again. We're going to round back, take the hips back to the heels, and this time you should get a really strong stretch in your left shoulder blade. So we did quite a bit of work on the upper back last week and around the shoulders. I'm going to continue that this week. So just hold this pose here for a few breaths, noticing how that feels in the upper back, in the shoulder blade area. And then when you want to come up, push into the shins again and rise up. Bring the hand back to the centre, and then take the right hand across to the outside of the left hand. Roll the spine to the ceiling, and then again just ease your hips all the way back onto your heels. Now feeling that stretch across your right shoulder blade, maybe the right side of your rib cage. Take a few full breaths here. And push into the shins, rise up. And then just come and sit back onto your heels for a moment. Again, if you want to, you can place a cushion or a block between your thighs and your knees, particularly if you feel that your legs are quite swollen at the moment. And move a little bit for the wrists. So bringing the palms of your hands together quite high up, and then you're going to roll the backs of your hands around, and then you bring the hands in front, and then roll them. So you're trying to roll the wrists around, and you kind of have to bring the hands in halfway just so that you can get into the wrist. So it's kind of an unknown or an uncommon problem in pregnancy is this wrist niggles. Some women get what called claw fingers in the morning. They wake up and their fingers it's to do with the carpal tunnel nerve, which comes out of the neck vertebrae, and runs down through the shoulder. And for some women in pregnancy, it gets compressed. So then we're going to kind of do a more of a sort of an Indian dance move, where they're spiraling away from each other. And then give them a shake up and down, side to side, and then horizontal chopping. And release. So now we're going to come up and down from this kneeling position. It's going to be quite good for the thighs. We did this last week. So as you breathe in, push the shins into the ground, rise all the way up and take the arms up over the head. And as you breathe out, come and sit back on your heels, but try to stay as upright as you can, so you feel your thighs working, and the knees will click. They might do as well. It's because you're pulling on the quads, and then that often makes that horrible kind of clicking sound. So again, push into the shins and squeeze your pelvic floor muscles as well as you rise all the way up. And then palms come together. Try and keep the body upright as you come all the way back down. Once they click, once they don't do it again. Push into the shins, rise up. And keeping the body upright. Sinking down. Last time. Lovely. And then from here, coming back onto your hands and onto your knees. So you're going to have that little cramp stretch again. So pushing the right leg away, bringing the ball of your foot into the ground, and then pushing your heel away. You just lengthening into the calf muscles. So again, if you're having any cramping at night, I'm now going to have to say 99.9% effective. If you do this before you get into bed, it can, in most cases, prevent. And then cross the leg behind and squeeze. We're going to hold and squeeze the thighs together. We're going to squeeze the pelvic floor muscles as well. And we're going to do that for 3 long breaths. So squeezing the thighs together, squeezing the pelvic floor muscles. And then release. But now you're going to circle the leg all the way round until foot is level with your right hand. And then just a little bit of lunging forwards and backwards. Easing through the hips. Now the next time you lunge forwards, if like me your knee has gone considerably further forward than your foot, walk your foot forwards until your shin is vertical. And then from here, place your hands onto your thigh and rise up. Now let your tailbone lengthen down towards the floor. We're going to do a few little kneeling warrior moves here. So imagine that you're gripping a ball between your thighs. If when you come up you've lost your balance because your foot is too far forwards now, you can always shuffle it back a little bit. Imagine you're gripping a ball between your thighs, so both of your thighs are kind of drawing in towards each other. So this is another good one for symphysis of pubis and dysfunction, so drawing the thighs invisibly together. So as you next breathe in, push your left shin into the ground, your right foot into the ground. Let the ribs lift up away from your baby and no effort in your shoulders. So don't use your shoulder girdle to lift up, really relax them down. And on your out breath, just twist towards the right and open the arms out to the side. So a little bit of a twist. And then inhaling, push into the shin and the foot again to rise up. So you're using the ground to help you with your movements. And then on the out breath, turn towards the left and just open and unfold the arms. And then inhaling. Coming back to the centre again, keep pushing into the shin. And then bring the hands all the way down. This time reach the arms behind you and interlace your fingers and squeeze the shoulder blades together. You might want to take a step wider with your right foot and then bow down towards the ground. Let the arms rise up unless you've got high blood pressure, in which case keep them on the lower back. And then release your hands down onto the floor. Slide the right leg all the way back, so coming in for a second calf stretch. So pushing the heel away. And then bringing the knee to the floor. Now making space between your knees for your baby again. Roll the spine to the ceiling and gently take your hips all the way back onto your heels. And then just have a little bit of a sway from side to side. The more times you do this, the more space you might feel starts to develop in the lower back. And then when you're ready, pushing into your shins to rise all the way up. And then coming back with neutral knee, so bringing them back into a neutral position. Now taking the left leg behind you, pushing the heel away. And just holding that for a few breaths. So particularly if these muscles are tight, that is usually an indication that you might be prone to some cramping. So ideally you hold the stretch until it doesn't feel intense anymore, until there seems to be a little bit of softness materializing in the calf muscle. And then you're going to cross it behind the right thigh. You're going to squeeze your thighs together strongly, and you're going to pull up through your pelvic floor muscles. And you're going to hold that for 3 long breaths. So gripping and squeezing as much as you can. And then circling that leg round to the outside until it comes to the outside of your left hand. And then just easing forwards and backwards. So shifting the weight forwards and then backwards. And then coming forwards and maybe walking the foot a little bit further forwards if it's not underneath your knee joint, and then pushing your hands onto your thigh to rise all the way up, lengthen the tailbone down towards the floor, and then pushing to the right shin and the left foot, and notice how that starts this process of lengthening upwards. As you start to take your arms out to the sides, let your rib cage lift away from your baby and keep your shoulders nice and relaxed. So this is one of the main reasons we get shoulder ache, is because we try and do everything from tight shoulders, but actually if we use the ground and push into the ground, it should create this feeling of spaciousness. Breathe in here. And then as you breathe out, open around to the left, so a little twist. Open the arms to the side. And inhale. Back to the centre. Shoulders are still relaxed. And then on the out breath, turn towards the right. Open the arms out. And then as you breathe in, come all the way back to the centre. Breathe out, take the arms all the way behind you and interlace the fingers. Squeeze the shoulder blades together. Lift the arms. You might want to take the left foot slightly further out to the side. You can bow down. Now again, if you've got high blood pressure, you can keep your hands on the lower back, otherwise you can raise the arms up. If you've got low blood pressure, this should be quite nice to do. And then from here, release the hands all the way down to the floor. Slide the left leg all the way back for a second half stretch. And then bring the knees down to the floor. So I'm going to give you an option now. You can either go back onto your heels with the rounded back, as we have been doing, into child pose, or you can come into downward facing dog. So it depends how much energy you've got, what your blood pressure is like, and also what your wrists are like. So also what your heartburn is like. So there's lots of different reasons. So if you feel like a down dog, it's going to work for you. And you can have a little stretch here, pushing into the heels of your hands. Just lengthening into the legs, lengthening into the spine. But if you feel that you would rather not do this pose at the moment, and to be honest, towards the end of your pregnancy, you know, it's not the most easiest thing to get into. And then when you're ready, you can come back into the all fours position. Now keep your toes tucked under, walk your hands back towards your knees, lift your knees up. They'll need to go either side of your baby, and then just notice how this squatting position feels. Can you take the feet a little bit wider and just play around? with some squatting. And if you swivel from side to side, you can quite often just get one heel down onto the ground as you swivel around. And then come back to the centre. I'm just going to uncurl to standing. So drop heels to the floor. And then just dangle for a moment over your bent legs. And then to come up slowly. So push the feet into the ground. Keep the knees bent and uncurl the spine. Okay, so we're going to do a little bit more work in the upper back. So this is a kind of a chest pull and push, but it's mostly a pose that's going to get into the scapula. So as you breathe in, draw the shoulder blades towards each other, and then as you breathe out, interlace your fingers, stretch the arms forwards, but then what you want to do is pull your scapula away from each other. So there's a tiny rounding in the upper back, but you can really feel the scapula, the shoulder blades, pulling away from each other. And then on the in-breath, you're going to take the elbows back, and the scapula are going to squeeze towards each other. And on the out-breath, they're going to pull away. So just continue that for a few more breaths. And what you're doing here is kind of almost massaging the scapula so that they're becoming a little more free. Because often all of the muscles that support the scapula get tight and knotted. And what we're doing here is hopefully just removing some of those knots. Okay, so the next time you finish, coming to the front, you can just relax, give the shoulders a little bit of a shake. And then we're going to have some side bending, so having your feet underneath your hips so that you get a really nice rounded base. And then push the feet into the ground, and as you breathe in, take the arms all the way up. And then take hold of your left wrist, and as you breathe out, don't pull over with your hand, instead lengthen the waist. So it's not an aggressive pulling, it's just a softening of the side of the body. And then on your in-breath, push into your right foot, and that should hopefully bring you back up. And then you swap the hands over, and the next time you breathe out, just elongate through the right side of your body. So you're softening over to the side rather than pulling. And then as you breathe in, push into the left foot to rise up. And just do that once more on each side. So you can just work the breath as you need to, but it's a softening, a releasing over to the side, and then pushing into the opposite foot to come all the way up. So that helps you to rise up. And once you come up this time, just releasing the hands all the way down. So we're going to do a standing labour move. So this in labour really is comfortable at the early stages of labour, and then as labour progresses you might find that you want to come onto all fours. A lot of women like that grounded position during labour. So as labour progresses you kind of seem to want to get closer and closer to the ground, to the earth. So initially, this upright standing pose can be quite useful. You can hold on to a chair, a table, staircase, bookcase, no, not a bookcase, a commode. Or you can be supported by your husband, your partner, and they can come behind you and you can kind of rest back into them. But you're going to do a figure of 8 this time. So you're going to circle one hip in one direction, and you're going to circle the other hip in the other direction. And it's a little bit like a belly dancer, so you actually want the hips to be the driving force and the knees to bend. So rather than keeping the legs straight, because then it's quite difficult, when you bend the knees you can really get the pelvis to move. And these moves are particularly good for helping your baby find the best position through the pelvis during labour. Also really good pre-labour with breech babies. So again, you know, when you feel there's that turning happening, or if you feel that your baby's trying to get into a good position prior to labour, so from sort of 37 weeks onwards, then these movements are quite good. We're going to change direction now, and you're going to use a straw breath. So this time you're just going to blow your breath out through your lips as if you have a straw in your mouth. So this is a much more softer breath than the ocean breath that we did before. So ocean breath has a lot of power and energy to it, but this breath is very calming and very soothing. So just allowing your breath to blow. And can you see what's happened? Straight away I can see what happened. As soon as you started working with the conscious breath, did you all recognise that you are now doing half time what you were doing before? So not breathing, not thinking about the breath, breathing and thinking about the breath. It's really different practice, isn't it? This is why in yoga we are so fussy about the breath. It's all about the breath. This is why. As soon as you start breathing consciously, you use a different part of your brain. Okay, and then gently come back into stillness. So it makes sense, doesn't it, while you're birthing, to have that control over your breath, because you're just in a very different space. So we're going to do a shoulder stretch and a balance now. Some of you will have done this before. You might find that because we're already on a carpet, if you've got quite a spongy mat, it may be a little bit too much of a wobbly base to balance on. So you might just want to come onto the carpet itself. I'm going to come sideways so that you can see what we're going to do. So again, if you need the wall, you can also do this. You can turn sideways and just have the wall there, and you'll just do your flamingo wing with one arm. So you've got a choice. We're going to bring the right knee forwards, and you can either place the foot to the outside of the left foot. So you're just on the ball of your foot, so that knee can bend. Or if you fancy a really strong challenge, then you can place your foot on top of the right foot, and that will give you much more of a challenge. And then you can either take both arms or just one arm if you're using the wall for your support. On the inhale, we raise the arms up and bring the palms of your hands together. So we'll go through it slowly first time, and then you can work it through with your breath. And then on your exhale movement, you're going to fold forwards, and you're going to frame your right knee with the hands, and then you're only going to be able to come so far forwards because your baby and your thigh are going to connect. But at that point, you still keep stretching the fingertips down to the floor. So you want that very similar effect to what we did here. We're pulling the scapula away from each other, but you've also got a really nice stretch going through the whole of your back of your pelvis, and all the way down the backs of your legs. So you stretch the fingertips towards the floor, and then on the in-breath you're going to come up, and it helps a little bit if you slightly soften the left knee and you push into your feet. You sweep the arms out to the sides, keep pushing into the feet, and lift your chest and come all the way up. So you're going to do that, and then exhale, fold again. So fold forwards, take the arms either side of the leg, and then stretch as far down as you can, and then inhale, bend the leg, push into the ground, and sweep all the way up. And just do that 2 more times. So again, paying attention to the breath. And then when you're finished, just bring the hands down, releasing the hands. Now that right leg, you're going to step it all the way back. I'm going to put my mat back, and I'm going to come sideways. I'm going to run out of space to go backwards here. But we're going to basically come into Warrior One. So this is going to be the second of our calf stretches. So just to see if it's a little bit stronger than the kneeling variation. So Warrior One, both hips are facing forwards. You might want to come onto the ball of your right foot first until you can get your hips level. and then squeeze the heel to the floor, and the left knee stays bent. You don't want to over rotate your pelvis too much, so draw it back a little bit. You do want to stretch into that back heel. So does that feel like a strong stretch, strong calf stretch? Better or not better?
Not as strong as when I'm
on all fours, okay. Okay. And then take the arms out to the sides, but broaden across your chest and keep the shoulders really relaxed. Push into the ground with your feet. Bend the elbows into cactus arms. Drawing back through the shoulder blades. Keep pushing into the ground and then just lengthen the fingertips up to the ceiling. So we're coming into an arm raising movement without using our shoulder muscles at all. And just notice how different that feels. It's a much nicer way of raising the arms without engaging your shoulder. And then release the arms. And then shift your weight in the front leg and just drag the back foot forwards. And then we're going to do the same on the other side. So now you're going to take the left foot to the outside. Come onto the ball of your foot, grip the thighs. If you want that stronger variation, you can bring the toes onto the top of the foot. And then inhale, take the arms out to the side. And as we take the arms over the head, think of what we've done today in the sense of not engaging the shoulders, keeping everything soft. And then breathing out. Slowly folding forward, stretch the fingertips towards the floor. And then breathing in. Pushing into the floor with your hands. Rising all the way up. And then same thing again, breathing out. Folding forwards. And breathing in. Rising. All the way up. So we're going to do 4 all together. And then when you come up this time, you can just put the hands down. And then you're going to step back with the left leg. So undo the leg, step it all the way back, and then come onto the ball of your foot again until you can get your hips level. And then squeeze the heel down to the floor. Lengthen the tailbone towards the floor. Take your arms out to the sides and then relax your shoulders. Feel a broadening across your chest. Push both feet down into the ground. So really engage the feet with the floor. And then bend the arms. They're going into cactus arms first. Shoulder blades lightly squeeze towards each other. And then from here there's a gentle extension upwards. So we're just taking the fingers up, the arms and the shoulders barely involved. So everything stays soft. And release. Come down. Shift your weight into the right leg and just slide the toes forwards. And then back into just some normal circles here. So working with your straw breath again. So blowing the breath out between the lips. And then just gradually working into stillness. And then coming into neutral position. So the last thing I want to do today is to have a look again at some of this sort of pelvic neutrality, which is particularly useful when you have symphysis pubis dysfunction. One of the tricky things with this issue is this torquing of the two front sides of the pelvis. So the thing that normally holds the pelvis into a secure place is this tiny little bit of cartilage called the symphysis pubis. It's not, we call it the pubic bone. It's not actually a bone, it's a piece of cartilage. And because it's a soft tissue, relaxing softens it. So if there isn't enough muscular strength around the pelvis, when that becomes soft, the whole pelvis becomes unstable, and then you get clicking, you get pain, some walking and rolling over in bed. So what we're going to do here is we're going to neutralise the pelvis for when we do asymmetrical movements, because it's things like getting out of bed, walking, climbing stairs, all of those things that can aggravate symphysis pubis dysfunction. So you're going to put your hands on your hips and find your hip bones. Pregnant women always laugh when I say that. I haven't seen my hip bones for 6 months. So have a bit of a dig around and see if you can feel them. And then we're going to keep them neutral. So imagine you've got a line drawn across your pelvis. Again, when we used to get a bit more up close and personal, I used to do this in pairs, and your partner would look at your hips and go, "You're lifting the left one up." So we can't. Well, you can do it across the room actually. Yeah, you can. Can you see? Can you see across the room? So you can tittle tattle on your cross person. So what you're going to do is just lift the right heel off the floor, and then lower it down, and then lift the left heel off the floor and lower it down. But what you want to be doing is keeping the hips absolutely level, because ordinarily we would do this. This is how we walk, isn't it? Hips would lift. And this, if you can imagine what's happening to that symphysis pubis, this is happening, which is why it's so uncomfortable. So what you're trying to do now is actually use your glutes and your thighs instead, which are, particularly the glutes, they are part of your pelvic girdle. So a strong pelvic girdle, strong muscles around the pelvis support the symphysis pubis. Okay, easy, hard? So now, next time we're going to lift the right knee off the floor. So you're going to do the same thing. You're going to lift the knee up without the pelvis lifting and lowering down, because this is what you want to do when you walk up the stairs. So you want to be able to do that manoeuvre with a neutral pelvis, without the pelvis tilting up and down. Yeah, it's hard, isn't it? So again, if you do have symphysis pubis, you have to kind of be a little bit more mindful about your movements, because it's so easy to do like just a normal movement that you might ordinarily do and then go straight into a pain situation because the pelvis can't support it. But it's good training anyway, just doing this. It's quite, can you feel the muscles having to strain and also the brain having to strain as well. So if you are suffering with symphysis pubis dysfunction, that's quite a good one to do from time to time. It's just kind of from now on until your baby is born, just being mindful of how you're kind of manoeuvring around the pelvis, because you don't want it to get worse. Okay, that's kind of in addition to like all the strengthening that's in the notes. Okay, so we're going to curl down. Oh my God, it's 8:28. Easing all the way down, have a little dangle. And then from there you can just walk your hands forwards until your knees come down to the ground. And then you just swivel around, come back into a comfortable seated position. So no relaxation tonight, ladies. We'll just have a very short breathing practice. Let's have a long discussion at the beginning. So we'll just have a couple of minutes of Tibetan Brahmari. So this is a really comforting and soothing breathing practice that does actually feel quite meditative as well. So Brahmari, or Brahmari, is bee breath. So in Sanskrit, Brahmari means bee, bumblebee. And what this practice does is you're just going to hum. But we're going to do a specific thing with the head. So we're actually going to turn it from an outside noise, an external noise, into an internal noise. So about halfway through, so we breathe in and we just let the arms come up. And then on the out breath, we begin the humming round about here. And then halfway through the humming, you're going to cup your ears with your hands until the end of your out breath, where you finish your humming. And it has this lovely effect of going from an outside noise to an inside noise. And it becomes very soothing. So what you might want to do is make sure that your pelvis is back against the wall, so that you're not sort of hunching, because that can start making you feel uncomfortable. So make sure that your pelvis is right the way back, and then I'll start, and then you just join in when you feel like it. You do feel a bit silly first of all, but the kind of the benefits outweigh the silliness. Just carry on at your own pace a few more times. Don't worry about all humming together. No one can hear you. Just do one more. And just notice how that practice feels. So there are some lovely qualities from that bee breath, and one of them is this kind of meditative silence and stillness that comes after it. So it's a very pacifying practice, but it's also very soothing for your baby as well. So it's a useful one to do throughout. It's like a connection that you can have with your baby, and then if you use that breath, that sound during labour at some point, then your baby will recognise that sound, and that connection will still be there. Okay, thank you all, Yogini Mamas. Namaste. Namaste. So you know this word namaste, it's like I bow and offer my salutations to you. Namaste, I bow, offer my devotion, and it's kind of quite interesting that you do it. Your baby is right there. I offer my devotion, yeah.